World Health Organization Global Health for Peace Initiative by Nicole Dailey-Fairchild. Global Health for Peace Initiative was implemented to provide peace-responsive programming. During a state of political unrest and armed conflict, peace and health are disproportionately disrupted on various domains. Interventions are aimed at peace-building and promoting trust in an effort to restore humanity. Development of the World Health Organization, or WHO, was established in 1948. It's representative of the United Nations committed to global health and safety. The nations united in an effort to collectively increase health awareness, safety, and serving those most at risk in the world. WHO is represented globally by experts in healthcare, such as doctors, epidemiologists, scientists, and managers to collaborate responses to health emergencies, health promotion, disease prevention, and healthcare access expansion. WHO Global Health Quarters are in Geneva, Switzerland. The Swiss Federation has moderated since establishment in 1948, and the main facility was inaugurated in 1966, which is currently in renovation to be completed tentatively in 2024. The organizational structure consists of 6 regional member states, 150 offices worldwide, and 194 member states. WHO member states are dispersed globally, represented by 6 regional offices with locations in Africa, Americas, Eastern Mediterranean, Europe, Southeast Asia, and the Western Pacific. Dr. Tedros Adhanom Ghebreyesus was elected WHO Director General for a 5-year term by WHO member states in May 2017. He was re-elected in August of 2022 for a second term and was the first elect from the WHO African region as General Director. The governing body of WHO is the World Health Assembly and Executive Board, which is attended annually by member states held at the WHO headquarters in Geneva, Switzerland. The itinerary focuses on policy determination, financial policies, proposed budget, and election of Director General. WHO receives its funding from 2 main sources. Member states pay membership dues every 2 years, and voluntary contributions from member states and other partners. WHO's budget is largely dependent on voluntary donations, with only 20% coming from member dues. WHO values include serving the public, prioritizing needs accordingly, and providing unbiased, prompt care, commitment to excellence in health, demonstrating nobility and implementation of evidence-based practice, integrity and self-accountability, collaborating with colleagues and partnering members to enhance the benefits by integrating biodiversity, and caring about humanity. A key objective of World Health initiatives are health equity and healthcare access among nations. WHO notes peace within and across nations is also a stated goal of many governments and bodies like the United Nations. Initiatives were inaugurated to address risks to health and address inequalities among nations. Additionally, insecurity in many places interferes with availability to social services with the health branch most affected. Global improvement for people to have livelihood and longevity. Global Health for Peace Initiative. Healthcare provides a mutual understanding viewed as a non-threatening gesture during a state of conflict to build peace. WHO implements evidence-based and scientific principles in times of strife. WHO employs humanitarian values in fragile, conflicted, affected, and vulnerable, or FCV, settings in a predictive approach. The Global Health for Peace Initiative addresses sources of contention that influence discord and bloodshed arising from unattainable healthcare access and other services. WHO advocates equal distribution of health and social services is imperative in areas of crisis. Preventative, tactful measures should be taken to avoid provoking unrest to achieve peace and health services. Applying the Global Health for Peace initiative in Africa. Almost 2 billion people in Africa live amongst dispute and rivalry known as fragile, conflict-affected, and vulnerable, or FCV, settings. Conics and supporting authors confirm deaths related to armed conflicts in sub-Saharan Africa, Middle East, and North Africa exceed the death toll in any other region. Most regions within Africa lack infrastructure to cope with those adversely affected. During times of dispute, the Peace Initiative's objective is to accomplish a state of well-being, but also peace building during the process. Literature supports the Peace Initiative strives at working on conflict in addition to working in conflict. Conics and supporting authors also reports initiating health for peace in Africa involving 3 tasks. Number 1, evaluating the circumstances by conflict analysis. Number 2, conflict prevent and management by applying the do no harm principle. Number 3, finding connections between peace and health benefits by making the project peace responsive and building trust. These methods have been found useful in peace-building initiatives for Africa in as well as other countries. China's global role in peace initiative and development. The Belt and Road Initiative, developed in China, provides an annex between land and sea routes in regions such as Central East Asia, Africa, Europe, and Middle East. China emphasizes neoliberalism by advocating for advancement of the economy and common trade, offering stability, security, and growth, especially in developing countries. Katak contends establishing these trade agreements can globally impact almost half the population. This paves the road to global peace and development by reforming social welfare and economic certainty by providing equal opportunity. Global peace and children. Globally, 10% of children are directly and indirectly adversely affected by armed conflict. Literature confirms purchasing weapons and disputes are interdependent, ultimately leading to hostilities and bloodshed. Global peace inclined all United Nations members to reach an agreement to reduce spending on the defense budget by 2% for 5 years, and no country has a greater advantage over the other. This measure will not only minimize the chance of war, but the finances could also be used economically towards government spending and global funding projects that are major problems, such as climate change, pandemics, and extreme poverty. Social health determinants and peace. Health and peace are interdependent. Social determinants of health impacted by peace and health include socioeconomic status, living environment, and educational level. Abuleish and supporting authors also report individuals who lack social, financial, and other forms of power are at higher risk for exposure to harms associated with social and other forms of violence. A study was done on the quality of Colombian victims' lives from armed conflict after peace agreements were established. Victims were subjected to torture, kidnappings, sexual assault, internal displacement, and witnessed homicides. Additionally, Simancas and Fernandez and other authors explains how kidnappings, sexual assaults, and events where minors were involved affected mental health. Victims of sexual assault were those whose quality of life was most affected, and torture victims had a lower index of global quality of life. Actions of violence and cruelty have left victims throughout the national territory, mainly in rural areas, promoting forced internal displacement. Despite victims receiving aid, findings indicate quality of life remained medium-low to low in comparison to the unaffected Colombian population. Literature supports circumstances surrounding victims' well-being were significantly attributed to economic stability, educational access, social and community life. In summary, the Global Health Peace Initiative can be achieved through establishing trust and coherent peace to resolve conflict and work towards solidarity. This concludes my presentation. References are on the following slides. Thank you.